Good afternoon, everyone. Welcome on this beautiful day to University Hospital and Rutgers, New Jersey Medical School. My name is Sharif Elnahal, proud to be the president and CEO of University Hospital. And I want to recognize Dean Johnson and his incredible team at the medical school for allowing us to do this today. The governor may be leaving them. So I want to thank Governor Murphy once again for joining us here in Newark to make a significant announcement on vaccination. I remember when we kicked this off after we vaccinated the incomparable Maritza Beniquez. Raise your hand, Maritza. The first person in New Jersey, one of our nurse heroes, to be vaccinated outside of a clinical trial. And that was no problem, Governor. That was an incredible milestone, and we are here to celebrate yet another milestone that the governor and our esteemed Commissioner of Health will talk about. And everyone here knows that Newark was a major front in the war against COVID in New Jersey, and we were proud to battle this alongside literally everybody in this audience and the entire city of Newark and the surrounding region. Since we vaccinated the first person in New Jersey, alongside our governor and commissioner, we've made so much progress on this campus toward the milestone we celebrate today. And we're proud to say that our efforts in cooperation with our partners and colleagues around the state have truly moved the needle. Over 20,000 people from our community were vaccinated right here on this campus. 20,000 people who now have protection and peace of mind from this virus. And that is to say nothing about the vaccinations that our incredible team at University Hospital, many of whom are here today, enabled elsewhere, including at the FEMA site just blocks away from us at NJIT, which delivered over 200,000 shots to people across the region. So as fate brings this milestone to us on the eve of Juneteenth, finally recognized by this country with the significance that it deserves, I can't help but mention that our goals around health equity aren't just words for us. This isn't an academic issue to us. This isn't abstract to us at University Hospital. I remember walking around our hospital during the worst of the surge, in some cases carrying PPE to our frontline heroes to assist them. And you couldn't help but notice that almost every person in our rooms was a person of color. And the disparities we see in almost every sphere of healthcare outcomes in this state and in this country are, again, apropos of the fact that this milestone we're celebrating today is right on the eve of Juneteenth. None of this would be possible without the support of the Commissioner and her incredible team at the New Jersey Department of Health. Thanks to her for being here today, and the Governor's leadership in bringing every resource to bear. Thank you both, and thank you all for the honor of working with you throughout this pandemic. I do want to recognize two special guests today as well, besides our esteemed board chair, Tanya Freeman, who's in the front row here. We have Mr. Junius Williams, who's the city historian in Newark. Round of applause. As well as Larry Ham, head of the People's Organization for Progress and an incredible activist here in the city. Thanks to you, Larry, for being here. We just had an incredible Juneteenth celebration event with our employees, and I couldn't think of a better way to follow that event with this one. So without further ado, Governor Phil Murphy.
Thank you, Sharif. Great to be back at University Hospital. Talk about a day the Lord made, huh? This is extraordinary. A little bit better than the day one, Maritza, that we put the shot in your arm, which was, we'll get to that in a minute. Sharif, thank you. As the CEO of University Hospital, former health commissioner, dear friend to you and your team here at University Hospital, Madam Chair, the entire group of doctors, nurses, other staff members, you've been extraordinary. Honored to be back and with you. Just got a great tour. Judy, you're going to talk about one of the triplets in your remarks, I hope. One of these mobile vaccination sites. Just really impressive. Honored to be with the woman who needs no introduction, the Commissioner of the Department of Health, Judy Persicelli. Superintendent of the State Police right there, Colonel Pat Callahan is in the house. Dean, as was already mentioned, Rutgers, New Jersey Medical School Dean, Dr. Robert Johnson. Great to be with you, Dean. We have Assemblywoman Cleopatra Tucker is in the house. God bless you, Assemblywoman. What a treat. He works at University Hospital, but importantly, he's the first Muslim American commissioner in the history of Passaic County. Assad Akhtar is with us. Assad, great to see you, my friend. Junius, thank you as always for being here. A treat to see you. And Larry, as I say it every time I see you, Princeton has never been the same. And we're going to refer to you instead from now on as Amani's dad. That's the proper way. Great to have you all here, and to each and every one of you, it's a treat. It was 185 days ago, on December 15th, 2020, when Judy and I came to join Sharif and his team to watch that woman right there, Maritza Benikas, of the great frontline healthcare heroes here, lift her sleeve to receive the first dose of a COVID vaccine administered in our state. Maritza and I were on virtually yesterday. We're now back together again today. Great to see you. Let's hear it for you as recipient number one. Again, that was shot number one. Now, long before that day, Judy and I had publicly announced our goal for New Jersey, which we would see to it that 4.7 million eligible individuals who live, work, or study in our state would become fully vaccinated. With the arrival of the first Pfizer vaccines in mid-December, we decided to focus on reaching that milestone by this June 30th. That was not only an extremely aggressive goal for ourselves, but it was one of the most aggressive in the country, and we knew it. We knew that getting to 4.7 million fully vaccinated eligible individuals who live, work, or study in New Jersey in little more than 6 months would take a comprehensive statewide approach. Just do the math. It requires you to average tens of thousands of shots in arms a day, every day. It would require us to think big and think creatively. It would require us to reach out to form broad partnerships at all levels of government, with the private sector as well, and across all of our communities. And it would require us to build public health infrastructure, in some cases from scratch. It would take building confidence and getting out the facts, such as these are free. You could get a vaccine regardless of your immigration status, to pick two. It would take bringing the vaccines directly to historically medically underserved communities. It would require patience through those early months of our effort, when the supply-demand imbalance made appointments hard to come by, even as we welcomed successive waves of eligible individuals into our programs. And more than anything else, we knew that it would require millions of you, with your faith in science and facts and data, and in the new post-COVID day that awaits, to raise your sleeves. And boy, did you all respond. Because of the millions of you who stepped forward to protect yourselves, your families, and our communities, today we are proud to announce that we have now exceeded our initial goal, and with 12 days to go before our self-appointed deadline. That is worthy of applause, I agree. Mary Maples is in the house. Mary, I should have acknowledged you. Nice to see you. We have officially crossed 4.7 million fully vaccinated individuals in the Department of Health's count. And by the way, we are not close to stopping. This is not in any way, shape, or form the end of history. Now again, to be clear, we are excited to be reaching this initial goal of 4.7 million fully vaccinated individuals. And as I mentioned, with roughly 12 days to spare, the operative word in that sentence is initial. We are not about to let up. Through Operation Jersey Summer, we're going to continue to reach deep into every community, alongside respected community voices, to push even higher. And let me be clear about something else. We would not be standing here today if it were not for that woman, Judy. We announced our vaccination program on October 26th, 2020, and by then, Judy and her team had already been engaged in this effort for months. Judy, as has Pat, has been with me at countless stops and at every step of the way. Now, Pat will attest to the fact that we've had to hold Judy back from wanting to jump in and administer a few shots herself. But she's been as superb a leader as she has been as exceptional a partner. The fact that we met our goal 12 days early says more about Judy and her team than I ever could. Each and every day throughout this pandemic, Judy has remained singularly engaged to save lives and protect public health. Our success in crushing the curves and meeting our goals is rooted in her leadership. When Judy took this job 2 years ago, you must be wondering all the time, what was I thinking? She and all of us had, from Sharif, by the way, who helped convince her, she had no idea that we were just months away from facing the greatest public health crisis in our history. Listen, the job of the Commissioner of Health, as Sharif and Judy can attest to, is a hard one on a good day. But over the past 15 months, they've been more trying beyond what any of us could have imagined. And the decision to ask Judy to serve as Commissioner of Health, as Sharif's successor, has more than proven to be the right one. She has been the right leader for these times. And remember, Judy is the first nurse in the history of our state to be the Commissioner of the Department of Health, and she's not once, but she's a two-time CEO of a hospital, an extraordinary career. So Judy, I don't know how you're going to react to this. I'm going to have a hard time getting through it myself, never mind you. But as some folks may know, the Department of Health recently moved into its new building in Trenton. I spoke yesterday with Senate President Steve Sweeney and Assembly Speaker Craig Coughlin, and we agreed that it needs a better name than just the Department of Health building. So they will be moving legislation, and I have to give my hat off to them and give them a lot of kudos here. And the legislation will be personally sponsored by each of Steve and Craig. And that legislation will name the department's new home the Judith M. Persichilli Department of Health building. Congratulations, Judy. It's richly deserved. One more time, everybody. I want to give a shout out as well to State Police Superintendent Colonel Pat Callahan. Pat, I've got no buildings lined up for you today, so I don't want you to come back to me later on and say, Murph, you let me down again. But listen, Pat has been extraordinary, and it's his teams from the All Hazards Incident Management Team, the Office of Emergency Management, with tremendous assistance from FEMA, our county and local health officials, healthcare partners who oversaw our 6 vaccination mega sites, and by the way, worked as seamlessly with one federal administration as he has with another. And that's a real tribute to the fact this was all about saving lives and keeping people healthy. So, Pat, we thank you for everything you have done, my man. Again, I got to come back to you on the building front. So, now our mega sites are winding down their efforts. They have now administered, however, in excess of 2 million doses, and they have fully vaccinated, at last count, nearly 1 million individuals, which is extraordinary. 6 mega sites plus the FEMA site that Sharif mentioned over at NJIT. Think about that. 1 million people fully vaccinated in those few locations. And we thank our healthcare systems and hospitals and every local health clinic and independent pharmacy that has been opening their doors to offer vaccinations. We also thank our partners at CVS and Walgreens for undertaking the effort of vaccinating residents and staff at our long-term care centers. We thank our other corporate partners at Walmart and ShopRite. We thank the community and faith leaders who have partnered with us to bring the vaccines into our underserved neighborhoods and vulnerable populations through Grateful for the Shot and through other initiatives. Everyone together owns a piece of this remarkable accomplishment. But again, let's make no mistake. This is not the end. This is not mission accomplished. This is not, remember Hank Aaron when he broke Babe Ruth's record? He didn't stop. When he got to 715, he hit another 40 homers. And that's what this is about. And that's what we need to do. We need to keep stepping up to the plate to get vaccinated. As I've said, we no longer have a pandemic among the vaccinated. We have a pandemic among the unvaccinated. So for yourself, for your family, for your community, please come help us push our total even higher. to 5, 6, 7, or even 9 million. Let's make sure everyone who wants to be vaccinated is vaccinated. And again, this is a great day. The first day of summer isn't until Sunday, but Operation Jersey Summer is wide open and in full swing. With that, please help me welcome the woman who needs no introduction, the Commissioner of the Department of Health, Judy Persicelli.
I'm a little stunned right now and a little speechless. My friends from university know that's hard to believe that I could be speechless. I love University Hospital. Governor, I don't even know what to say, except that it's a pretty long name, so it's got to be a pretty big building. I don't understand. Sharif, first of all, University Hospital has been such a great partner. Those mobile vans wouldn't be going deep into communities. They wouldn't even be on the street if it were not for the partnership that we have with UH. They are licensed under UH. Every time I call Sharif, say I need some help, it's sure. And I know then you all have to do the work, but I want to thank you for that. So today is a great milestone. Just over 6 months ago, we began this amazing journey to implement the largest vaccination program in our lifetime, perhaps in our history. We stood in this very courtyard, and minutes after the emergency department nurse, Maritza, got her shot, and then Dean Johnson followed, and I threatened to give him that shot. He ran away. They represented the start of a program to vaccinate our frontline healthcare workers, to whom, for each and every one of them, we owe such a debt of gratitude. They have saved lives every day, every single day. That day, on December 15th, we were filled with hope. Hope, the thought that what we wanted to see happen would actually happen. So we kicked off a tremendous effort to get as many people vaccinated as possible. Implementing a large-scale vaccination program never before done in our state was challenging, but we never lost sight of our critical mission. Our program was rolled out in phases. The prioritization of the phases were determined by the goals of the vaccine plan to first and foremost prevent morbidity and mortality, and secondarily to support essential societal functioning. We expanded eligibility based on risk, and by April 19th, it was until April 19th, all individuals 16 and older became eligible. Back in the fall of 2020, when we submitted New Jersey's vaccination plan to CDC, we considered it quite an aspirational goal to vaccinate 4.7 million individuals. Some people, even in our own Department of Health, thought that we were a little crazy. I guess they thought that I was a little crazy. But here we are, 4.7 million individuals who live, work, or study in New Jersey have been fully vaccinated, have been protected against this deadly virus that has killed more than 25,000 people in New Jersey. 1 in 500 people or more have succumbed. And we know that the disproportionate impact on communities of color is a lesson that we should never forget and we should carry forward with us. The health disparities that existed before the pandemic were only amplified, where young Hispanic men were 3 times more likely to die from this disease than their white counterparts. And black African American women and men twice as likely to succumb to this disease than their white counterparts. We can never forget this. So again, let me be clear. The credit for the success of this vaccination program goes well beyond the Department of Health. There are thousands of people who made this day possible, and it starts with our governor. He has stood by the Department of Health every step of the way, never wavering in his support of our program. His support made this achievement possible. Also, we could not have made this progress without the federal, state, local, community partners who have stood with us side by side, county and local health agencies, hospitals and long-term care facilities, community leaders, faith leaders, elected officials, all who have stood with us to make this program successful. They provided vital education and outreach. And yes, special thanks to Colonel Callahan, who has been a steadfast partner since day one, providing whatever support we needed whenever I called him, whatever I asked, day and in the middle of the night. Thank you, Pat. Couldn't have done any of this without you and your team. Most importantly, we're grateful for all of you, who have rolled up your sleeves and got vaccinated to protect yourselves, your loved ones, your families, your community. We now have seen a dramatic decline in cases, hospitalizations, and thankfully deaths, because we all pulled together as a state to stand up more than 1,500 vaccination sites, ranging from mega sites to drive-thrus to pop-up clinics in convenient locations like your local grocery store, pharmacy, or church. Everyone has stood up to be vaccinated, and everyone who has stood up to be vaccinated are part of the heroes of this pandemic. We will never forget those dark days of over a year ago when the unfathomable happened. We had scarce protection and life-saving equipment. I'm extremely proud of our state. We all came together to make this day possible. But as the governor shared, we're not stopping here. We want as many people vaccinated as possible. The Department of Health next week will be sending vaccine ambassadors to high-risk counties to work with elected officials, community leaders, school districts, faith leaders, because we will not rest until no doors are open to this unwelcome guest, COVID-19. Our state endured some of the worst of this pandemic. We owe it to the memories of those who we lost and those who are recovering that we do as much as we can. We owe it to them to do as much as we can to protect our communities. And every person vaccinated makes New Jersey a safer place. So if you haven't been vaccinated, please get vaccinated. There's more than 1,500 places you can go. You can find those sites on covid19.nj.gov/vaccine. Vaccines are safe, they're effective, and they're the biggest tool we have in our toolkit to fight this virus. So we will continue our work because we have promises to keep and miles to go. Thank you, Governor, for all your support. We couldn't do it without you. Let's have a healthy and happy summer. Let's protect our families. And 1, 2, 3, let's all get vaccinated. Thank you.
Thank you, Judy. We'll take a couple of questions in a minute, but before we do, a couple of quick notes. I think this is the real true measure of, are we serious about not stopping? What you see going on, for instance, this coming Monday, will look not one speck different than what we would have looked like yesterday or today. Today maybe a little bit because it's a state holiday, which I want to get to in a second. But the door knocking in the communities, especially the 10,000 and up residents that are under 50% vaccinated, those are our top priorities. As Judy said, we're going to expand that to a county approach. And we've got all these great contests and other things still out there. But it's the day in and day out drumbeat of knocking on these doors, working with local officials, county officials that really is moving the needle. And especially, I think, as well, we have to give a shout out again to our faith leaders and the grateful for the shot and the mobile units. We went almost overnight a couple of months ago. It flipped from being a reality where people were going to the vaccine, our mega sites being the best example, almost overnight. And we knew it would come, and we had a plan for it led by Judy. We then had to flip to bring the vaccine to the people. And we think we're going to be in that mode now until this thing is at last behind us. And secondly, again, Sharif, I'm in the midst of health experts. I don't think there's anyone still on the planet who can answer the question, hey, is one time around all I need for the rest of my life, or is this going to be an annual flu shot? And so we're going to keep a lot of our infrastructure in place because we may well need it again, if not on an annual basis, at least at some other point in the future until that question is solved by the medical and scientific experts. And then a shout out again, I'm happy to say I'm heading up to Patterson today right after this to sign landmark housing anti-discrimination legislation, one of a kind in the United States of America. And it's not a coincidence that I'm doing it on this day, which is the first state holiday ever commemorating Juneteenth. I'm glad, yeah. Very happy to see President Biden sign federal legislation yesterday so that today is a federal holiday, but I was even happier that New Jersey got there first, and that's the right thing. And I use the word commemorate a lot more than celebrate. Larry, you tell me if you disagree, or Junius see this differently, because this is not, it's a celebration in the sense acknowledging the end of literal slavery. But remember, it was June 19th, 1865 in Galveston, Texas, when the last slaves in our country were told that they were free. That's great, except Lincoln had signed the Emancipation Proclamation in January of '63. So they had lived 901 days in slavery, not knowing that they were free. So I think commemorate, and let's all acknowledge that we continue, and we will continue to be a long road digging out from now what is in the early years of the 5th century since slavery came to the shores of North America. So with that, anybody got anything? Sir. Yeah, so the question is, what are we doing as a state, and what is University Hospital doing in Newark and the other communities it serves to reach the most vulnerable? No one step, and Judy, if I miss anything, please correct the record. Mobile units, right there, one of 3 in the state, not by coincidence that it's in Newark right now. You said it was in Irvington yesterday, so mobile units. Grateful for the SHOT, which is a program with our faith leaders. Door knocking in the communities. I mentioned the 10,000 and up communities that are less than 50% vaccinated. They are not by any means all communities of color, but they are disproportionately communities of color. Those are 3 examples. There are many more. Sharif, you want to give a little color on what university is doing in Newark and the communities you serve?
Yeah, thanks, Governor. Nothing huge to add there other than, again, grateful for the mobile units that Commissioner Priscilli and the Governor have asked us to operate. We're not only operating in this region, but we've been in New Brunswick. We've been in many areas in the state that are particularly under-vaccinated, and we will continue to do that. And just in general, just be closer to where people are in the community with the vaccine. I think the barriers to vaccination around, essential workers not being able to take as much time off, especially for maybe a day or 2 of side effects, all those things, and the reforms that the governor has pushed, as well as the president, on paid time off to be able to accommodate that are just extremely important.
I would add to Sharif's answer, this is general, not just to the communities that they serve. Repeat, there are myths out there. This vaccine is free. No one asks about your immigration status. I'm begging, as Sharif alluded to, employers to do the right thing. Let your employees, give them the time off they need to go get vaccinated, and God forbid if they get some sort of a side effect, of which there are minor ones, but I'd say overwhelmingly just minor ones, give them that latitude. Thank you. Sir. At the moment, no. We're just going to keep the hammer down. We're going to continue to plow ahead. I fully expect that we'll cross 5 million. I don't know when, but that will not be that far in the future. I think at the moment we're just going to put our heads down and keep driving this thing. Brenda, I apologize. So the question, Brenda, if I heard it, in vulnerable communities where our penetration of the vaccines is not yet where we want it to be, and we'll stay at it until it is, what are we seeing in terms of caseload, severity, mortality, et cetera? Any comments on that, Judy?
We've actually broken down all of the vulnerable communities based on the 70% marker, and we know exactly how many individuals need to be vaccinated within a certain period of time. The county ambassadors have those performance metrics. We're matching them with the cases and hospitalizations. We're particularly being vigilant about individuals under the age of 12 that are not eligible to be vaccinated. We're working with our hospitals to monitor our pediatric census. We're seeing a little bit of increase, nothing significant yet, but that is part of what we call the county ambassadors package. So when they go out next week, they're going out with a handful of information and the authority to move things around, get deeper into the communities, set up vaccination sites, and reach our goal. Are there
elevated case levels due to lack of vaccinations?
Most of our cases in the hospital are with individuals that are unvaccinated. I think the governor has said, I think at the last press conference, this is becoming a pandemic of unvaccinated individuals.
May I say two other things, Judy and Sharif? Tell me if you want to correct the record. On that list of what are we doing for vulnerable communities, role models matter. So Dean, you're being there on day one beside Maritza, and Maritza herself matters. That sends a signal. And secondly, we're battling a sordid history in America of vaccines, particularly with communities of color, using folks basically as guinea pigs. And there's rightful skepticism that lingers to this day. So folks, it requires an extra effort, whether it's a role model, whether it's information, education, whatever it might be. And when we take all that seriously. Mark, I blew you off yesterday, but it wasn't personal.
Governor, we're coming out of this, but businesses in downtown Newark, they're suffering.
Yep.
So largely, how does the state help private businesses incentivize workers, private businesses, whether it's corporations like Prudential and small businesses? How does the state help private businesses incentivize workers to return to Newark and cities like it across the state?
Yeah, so Mark and I were together at the dedication of the Dr. Martin Luther King Jr. Courthouse right here in Newark yesterday, which is pretty incredible. I mentioned, Larry, that the George Floyd statue was unveiled on Wednesday and the Martin Luther King statue was on Thursday, and today is Juneteenth. I said, this is quite a week we got going on here, Junius, in the Brick City. No one magic wand, a series of things. Root causes, people will point to the potentially some impact of the $300 supplemental unemployment insurance, lack of reliable access to daycare, kids, although the school year is about to end, kids not in many districts not being in school full time, folks who are plain scared to get back in and enjoying the workforce. David Brooks in the New York Times today has an extraordinary, fascinating piece about a re-energizing of the American economy, particularly labor, and sort of the notion that coming out of the pandemic, there's historic vacating of job positions to seek what folks perceive as better available jobs. So we're fighting all of that. So we've put a lot of money into the small businesses that you're referring to already. I think the Economic Development Authority has helped over 55,000 small businesses. We'll continue to do that. So American Rescue Plan money. You're starting to see the businesses themselves. I was at Jenkinson's in Point Pleasant Beach yesterday with the family that owns that, and they do a great job. They're short labor, and I said, what are you doing? They're paying up more for labor. So I suspect we're gonna see more of that. That's not a bad thing, obviously. Workers getting more money is a good thing, but they're gonna have to, the small businesses are also incredibly important to us, so they're gonna probably pass that on, and that's probably going to contribute a little bit to some amount of inflation, which we're seeing a little bit of. I think it's a series of things. But Newark getting back on its feet, I've said this so many times, and it's true, as Newark goes, so goes New Jersey. So we'll go in the back and then down front, and then we get a hop, please. What does it mean for the folks in the state? Well, we've opened the state pretty much wide. So the only real restrictions right now to wear a mask, we wore a mask in any healthcare setting, so we did in the mobile van. If I went in to visit Sharif right now, I'd put a mask on as I went inside. A long-term care facility, a vulnerable population location like a corrections facility, trains, planes, buses. I don't think all of that is forever, but it is certainly for now until we know for sure that we're through this thing. But otherwise, My wife and I late dinner last night in a restaurant inside. It looked, it's back to normal, and we're hoping that we have the summer that we're all expecting. For the folks who have not yet been vaccinated, there's a whole range of things. Operation Jersey Summer has a lot of elements to it, including very basic stuff, myth breaking, information. As I mentioned, knocking on your door, reminding you what the facts are. Where's the closest location of, I think now, Judy, about 1,500 locations, plus or minus in the state, getting them to get vaccinated. Judy said it, this is now becoming a pandemic of unvaccinated individuals. Can a vaccinated person get it? Yes, but the chances of getting hospitalized, getting seriously ill, or God forbid, passing are exceedingly remote. We'll do one more and then we get to run. Thank you. Yeah, it could well be. Judy mentioned those mobile vans can have as an example, other uses. I'm sorry? Yeah, testing, generally other uses. The legislature has been fantastic, and we have worked with them and will continue to work with them. It's going to require, Pat, tell me if you see this differently, an ongoing relationship with FEMA and with the federal government. So it's not just within the four walls of New Jersey. And when I say keep the infrastructure, I don't necessarily mean literally. I'll give you an example. We had field medical stations. We've folded those up, thank God, we don't need them, but we have them in storage. So they are in a warehouse somewhere if, God forbid, we needed it. So that's an example of something, literally the infrastructure is not literally standing there, but we have access to it. I don't think there's any amount of infrastructure that can come close, however, to the cumulative learning curve, particularly among our medical community, and I don't have to say this in this setting, other partners. So unlike March of 2020, or Judy formed with Pat the first task force for COVID on February 2nd, 2020, unlike then, when we were dealing with something that was coming out of nowhere, the accumulated wisdom that we have, especially among medical and health experts, is our best weapon and will be our best weapon. With that, I want to thank Sharif, Madam Chair, Maritza, Dean, all the doctors, nurses, and staff at this extraordinary hospital, University Hospital. Pat, to you, as always, blessings. Madam Assemblywoman, thank you for joining us. A treat. Commissioner, to the whole team here, Junius and Larry, always an honor to see you guys. Thank you for everything you do in this great community. And last but not least, the woman who needs no introduction, Judy Persichelli. Thank you all. God bless you all.